So I apologize in advance because my kids are home, so it may be a little loud. So the first subject I'm going to talk about is pericare with the male and female. I did take some notes while I was reading the chapter. So pericare is basically the cleaning of like the genital area and the anal areas. It's common for microorganisms because it is moist in a dark area, so they grow there. Due to that, it's done at least once a day with bathing, or it could be done if the client soils themselves, if they have like a stool, or if they urinate. The supervisor will let you know if the client does need it done more than once a day. So some clients are different. Some need it done more often than others. When you're doing it, some clients might not understand the proper terms for it. So you want to use terms that they will understand. You want to wear the proper PPE when you're doing it. Definitely want to wear gloves. You want to go from the cleanest area to the dirtiest. Their urethral area is the cleanest, and the anal is the dirtiest. You want to clean around the perineum. Use 3 strokes. You want to go down the center and down each side. You're gonna use warm water. They usually have temperature with the employer policy. You don't want to be too hot because you can scold the client. You don't want to do that. You're gonna rinse thoroughly, pat dry to reduce moisture and promote comfort. When the client is soiled, you want to clean from the buttocks to the anal area. You want to wash the client's hands first, also because sometimes they will put them in their briefs, so you want to wash their hands. You might want to give them like a washcloth or something to hold on to, kind of, probably just to like distract them a little bit so they don't start touching or grabbing or anything like that. You also want to report or record anything. Like we learned in class, you're always looking while you're doing things, so you always want to pay attention to things that aren't normal, like odors, redness, swelling, discharge or irritation, hemorrhoids, and in males if the foreskin is not retracting. So for female pericare, when doing that, you're gonna go in, you're gonna identify the client. You're definitely gonna want to explain the procedure that's gonna be being done. You're gonna perform your hand hygiene, collect all your supplies that you are going to be needing in order to provide the care. You're gonna want to put your supplies close to the bed, like on the bedside table, just where they're in your reach. You're gonna want to provide privacy, raise the bed to a comfortable working height. You're gonna cover the client with a bath blanket. You're gonna position the client on her back, and then you're going to remove her garments from waist down. You're gonna want to apply that waterproof pad under the client's buttocks. You're gonna drape the client. You're gonna fill the basin with water. Once again, it's gonna be the temperature that is for your employer's policy. The basin and your work supplies and stuff are gonna be placed in reach, so you're not reaching too far or anything. Bedside table or wherever your working area is. You're gonna want to help your client like spread her knees, like flex her legs basically, if she's unable to do it herself. You're gonna put on your gloves, hold the bath blanket between your client's legs. You're gonna wet the washcloth with the water in the basin. the basin, whatever they're called. And then you're gonna squeeze out the excess water. You're gonna apply the soap if soap is needed. Then you're gonna separate the labia, and you're gonna wash the labia major closest to you. Then you're gonna do the farthest side using a different part of the washcloth, not the same part. You're gonna do one stroke downward, and you're gonna stroke it from the top to the bottom area. And then you're gonna do the labia minora. See, it's gonna be in the pretty much the same manner as you just did the other one. You're gonna obviously with a separate section of the cloth as well for each stroke. Once again, one stroke. Using a separate section of the cloth, you're gonna wash down the middle of the pubic area to the rectal area. One stroke, and you're gonna cleanse thoroughly around the clitoris area. And then you're gonna rinse the perineum with a clean washcloth. Then you're gonna rinse it, and you're gonna separate the labia. You're gonna stroke down in one direction from top to bottom. You're gonna go down the center and then down each side. You're gonna repeat if it is necessary with a clean part of a washcloth for each stroke, from the cleanest area to the dirtiest. Then you're gonna pat the area dry with a towel. You wanna make sure it's dry so it doesn't cause infection or anything. You don't want it to be moist still, because it will cause infection. It's possible. Then you're gonna fold the blanket back down between the client's legs, because you always want to make sure you're providing privacy and you want your client to just feel as comfortable as they can, I guess. You're gonna help the client lower their legs. You're gonna turn her on the side away from you when you're about to perform like the anal cleaning part for the rectal area. So then you're gonna apply soap to your washcloth. You're gonna clean the rectal area. You're gonna basically separate the buttocks and clean from the vagina to the anus with one stroke. That helps prevent the transfer of pathogens from the anus to the vagina. So you don't want that to happen. And then you're gonna repeat that basically until the area is clean. You're gonna rinse the rectal area with a washcloth. Pat the area dry with a towel. When you're done, you're gonna remove the waterproof pad, and then you're gonna remove your gloves and then wash your hands when you're done providing that care. So with peri-care with a male, you're gonna basically start off the same as you would with a woman client. Same first couple steps. You're gonna go in the room. You're gonna identify the client. You're gonna explain the procedure. You're gonna perform your hand hygiene. You're gonna get all your supplies that you need. Yeah, pretty much the same thing you would do, what I explained in the other video with a male. Provide privacy, all that stuff. And then once you do that, you're gonna retract the foreskin on the penis, especially if it's uncircumcised. Some people would say kind of pull it back, I guess you can say. You're gonna grasp it. And you're gonna want to clean at the urethral area. Sorry, I keep probably saying that wrong, but yeah, that's probably the cleanest part, and you always want to clean from the cleanest part to the dirtiest. So you're gonna keep doing that in a circular motion, and every time you do that, you're gonna use a clean part of the washcloth every time. You're gonna rinse that area with a washcloth. No, thank you. And then you're gonna return the foreskin, basically. Okay, sorry about that. So yeah, you wanna make sure that you rinse it properly because you do not want it to cause irritation. Then you return the foreskin back to its natural position. You want to clean the shaft of the penis. Firm. Downward strokes, and then you're going to rinse that area. Help the client flex his knees and legs if he's unable to, or spread his legs if he's unable to. You're going to clean the scrotum and rinse well. Observe for redness or anything, discharges, anything like that you would normally be still observing for, anything that's pretty much unusual as we would be observing anyways, pretty much. Then you're going to pat dry and the scrotum. Fold the bath blanket back down between his legs to provide privacy as well. Once again, help him lower his legs and turn onto his side, back away from you before you are going to provide the rectal care, basically. Then you're going to clean the rectal area just like you would from pretty much almost the same as the female, basically. You're going to rinse it and dry as well. Remove the pad once again. And then you're going to discard your gloves and you're going to perform your hand hygiene once the procedure is all done. So that pretty much sums up the peri-care for male and female. The menstrual cycle is basically like a woman's, as we would call it, basically their period. This happens usually once a month for a woman. It is when blood flows from the uterus through the vaginal opening. A lot of clients use sanitary pads, as a lot of other people would use like something called tampons or something, but I'm sure in the facility you will not see those. Clients on their menstrual cycle would be using sanitary pads, and you want to make sure you're changing that pad at least every 3 to 5 hours. You want to promote cleanliness, you don't like odors, all that. So you want to make sure you're cleaning that pad sometimes sooner if the client has, I would call it more of a heavy flow. You don't want their pads to be too full or overflow or anything like that. So you want to make sure you're looking at their care plan just to see. Sometimes maybe you might have to change it sooner than every 3 to 5 hours. You dispose of the sanitary pads, obviously, when you're done changing the pad. You're going to report and record any observations that you think are not regular, like odors, fever, redness, swelling, heavy bleeding, discomfort, large number of blood clots, just abnormal things like that you would want to repeat. So yeah.